Now I would like to welcome next to the stage the Gatekeeper Coordination Team. They will guide us through the journey of the project in reshaping chronic disease care and well-being at a European level. They will explain how the pilots have developed new digital services and solutions that shed light on the technological innovations that have driven this transformational change in care processes. Everything that you are about to witness today reflects the collaboration of nearly 50 organizations from more than 10 different countries and the dedication of more than 300 people who have made this possible. So now I want to go ahead and say a loud thank you to all of them. In this occasion, I would love to welcome to the stage Maria Teresa Arredondo, who serves as the Director of Life Supporting Technologies at Universidad Politécnica de Madrid. Maria Teresa will be leading this session with the rest of the project team, and I'm sure it's going to be an amazing talk and very enlightening for all of us today. Again, I welcome to all those who are joining us via streaming and all of you. So if we are ready, Maria Teresa, the floor is yours. Welcome.
Good morning. Today is a very special day for us, all the Gatekeeper community. And we are very excited to share all the results that we got during the project with all of you. Joining me today, we have some very important figures in the Gatekeeper project. Sergio Guillén, Deputy Coordinator of the project. Giuseppe Fico, the Technical Manager, and Leandro Pecchia, which is the Large Pilot Scale Manager. Together, we would like today to showcase, behind you, you have some of the samples of the results of the Gatekeeper project, and also to talk about the impact of the project on healthcare system all across Europe. And to start, I would like to ask you, Sergio, in brief, what is Gatekeeper project and which are the challenges that the project was addressing?
Thank you. Good morning, everyone. Thank you for the question. I will take the words of Germán. He make a very short presentation of the project. Gatekeeper is a large-scale pilot project that utilizes artificial intelligence to address three fundamental and unmet medical problems. The first is that the personalized early risk detection of chronic conditions on large population of older people. When this is done, the second challenge is to provide a sustainable healthcare, remote healthcare, which is phased essentially into the early intervention. And the third is to provide the conditions in order to create a new adapted therapies and treatments for this population of older people. For doing this, next please, for doing this, Gatekeeper has adopted a holistic approach in order to create an ecosystem that is supported on three fundamental pillars. The first pillar is the technology gear, which is basic on the Gatekeeper platform and infrastructure. This is going to support the creation for healthcare professionals, for healthcare institutions, the production of massive health data, which is of high quality. When this is produced, then this healthcare data is going to be federated for the primary care, for the primary use of this in treatment and in diagnosis, but also in secondary use for further medical research and artificial intelligence creation. The second fundamental pillar now is that that technology must be achievable, must be accepted by the community. Then we have created, together with this, a comprehensive business vision. And for this technological platform also support we have created the artificial intelligence framework which enable the technical professionals, technology professionals, to create, train, test, and produce artificial intelligence solutions for the aforementioned challenges. Additional to this, and no less important, is that we want that many other stakeholders are able to acquire, to get that artificial intelligence solutions created in the platform through a specialized marketplace. And the third pilot for this is that the enabler. If we have achieved all of this in terms of production of artificial intelligence, then the third pilot is the enabler that Gatekeeper plays a role in order to make easier the healthcare and to adopt artificial intelligence solutions in the healthcare domain. So Gatekeeper will intend to play a pivotal role in the deployment of artificial intelligence in the healthcare domain. In essence, Gatekeeper has adopted a holistic approach to address critical health challenges, leveraging cutting-edge technology with a comprehensive vision, business vision, and not less important, with creating an educational framework that will enable that Gatekeeper is going to have an impact in the healthcare practice in the future. Thank you.
Thank you very much, Sergio. Very impressive and important. We feel in our heart is the Gatekeeper project. And now I would like to ask to Giuseppe, which are the main assets of the main technological assets in the Gatekeeper project, and which do you think is the impact these technological aspects are going to produce in the healthcare in the European context?
Thank you very much. for this question and for sharing this stage with me. It's very important. Welcome to all the gatekeepers today, here in the theater and connected online. I remember the word gatekeeper was coming from several meetings and dinner that in the coordination team we had. At the beginning, you know, I'm from Italy, so the name was Showtime. So, but then we decided for a better name, Gatekeeper. And today I think I am able to tell to all of you, to all of us, what Gatekeeper is, thanks to the technological asset and the impact that we are aiming and we have achieved. Gatekeeper is, that's my definition of today, a secure and protected environment for an ecosystem of trust between industry, government, academia, and the community for active and healthy aging. That's Gatekeeper. This, in terms of technology, means that today we have reliable deployment, scalable, industry-oriented in terms of infrastructure, services, and AI environment that have been mentioned before. One of the elements of this project was the collaboration between these actors. And as a technical director, that's exactly how we design the project. So that's why I'm referring to ecosystem of trust. You will see later today more details about that. But first of all is what our beloved architect, Eugenio Gaeta, that will show you more in detail this in the next section, the muscle, the body of this infrastructure. It is a high-performant, highly reliable, highly available, highly scalable, and therefore highly cost-effective industry-oriented platform for a secure and protected environment where data among the different regional healthcare systems, European and also from a region outside Europe, Asia and others, have federated, exchanged data from different sources, from different contexts, in different conditions. Data that has been then used using HL7 Fire, and we have HL7 Europe as a partner of this project, federating a common data model for the exchange of AI services in a secure and protected environment. So that's a sort of central and peripheral nervous system of that body that we have been building. AI. We have produced a standardized pipeline for the secure and protected deployment, interoperable exchange of AI services that is already a reality, based on several and the most important standards, and if they were not available, we were even informing European Commission and other bodies on the new standards and regulations to deploy. We have in production 26 AI models for early detection and intervention, deployed and tested fully, as I was mentioning, in 8+3 European and Asian healthcare systems. And these services are interoperable and can produce the intelligence and inform the clinical decision-making that the ministry was mentioning before. But last, and I will conclude with my intervention, the value that had been mentioned also before in the previous section. So Gatekeeper is an ecosystem of thousands of people, workers, industry, organization, their families, that during these 4 years have worked together. Thousands of people that we tried to put together for the large-scale management of this project. This slide, of which I'm very proud because it was a sort of attempt to have a dashboard to have all the quantitative and qualitative indicators to create and generate this value that are related with social contract between citizens and professionals and much more other things. So that's what Gatekeeper and these technological assets have produced.
Thank you very much, Giuseppe. Proud to be Gatekeeper. And last but not least, I would like to ask Leandro, which has been leading large-scale pilots of several thousand of users in Europe. And I would like to know from all this experience with healthcare people, with patients and so forth, how do you think that this experience will impact in the artificial intelligence systems used by the healthcare community in all over Europe in the future based on the results of this Gatekeeper project?
Thank you, Maria Teresa, first of all, for inviting me here and now for asking this very smart question. Well, I think we have given a pragmatic example on how AI can help transforming healthcare in Europe and probably beyond Europe. We gave ourselves a very ambitious target. We pulled together 43 different partners from 13 countries. We organized 8 pilots in Europe plus 3 in Asia, and those are really the main actor, the ones which made things happen, the ones to whom our gratitude goes for the great work they have done. And our ambition was to arrive to a number which was 40,000 people involved, not just patients, people, across initially 8 conditions of later life, plus 1, which came along the life of project, which was COVID, as you may remember. And in order to face this complexity, we went straight to the point. We said, look, probably 90% of patients will not need complicated intervention. They need some primary or secondary prevention, because that's really the heart of the intervention that AI should have in Europe, considering the challenges we are facing associated with the aging of population. Then obviously there is a growing number of mild intervention, and then a small number of more sophisticated interventions which have been requiring more sophisticated and complex intervention in terms of technology. But then we also considered healthcare professionals as part of our pilot, because as a matter of fact, they are the ones which will benefit from this technology in order to make their own daily job much easier, much more released by trivial tasks, so that they can devote more time to patient, because that's really what they want to do. And then obviously there have been a part of caregivers, so not professional healthcare professionals, but rather family or informal caregivers, which have been also involved, because they play a crucial role, especially in some of the diseases that some of our pilots have been tackling, such as cancer in terminal stage. And what I think we should be really proud is on the way we did it. So we have now a clear framework on how we can start in order to understand the needs in what we call the preparation stage, which has 5 different steps in it, which starts from understanding and formalizing the problem, which is to me the most important part, to defining the key performance indicators, getting ethical approvals, fine-tuning the design of the studies in different regions, and then we move to the deployment, which is not trivial. We really need to get people aware of what they have to do, support them in the transformation of their job, and then start moving on the technology, installation, training, and all the technical things. But people are every time at the core of our attention. And just in the end, we get things up and running, and we measure what we do continuously, which leads me to this slide, which is giving a proxy of the complexity of the work you guys did. 21 different study designs. That's really impressive. And the reason for that was that we wanted Gatekeeper to be as close as possible to the work that healthcare professionals are already doing on the field. We didn't want to have one multicentric study working for all, because this is not the way health works in Europe. We have regionalized system among different nations. So we have to be as close as possible to the real practice in order to bring our technology to the place where this is really needed. But this obviously generated a quite complexity to be managed. And altogether, we reached this number at the moment, 22,000 enrolled people in the control group, 40,000 in the intervention group, more than 700 other intended as caregivers, healthcare professionals. And overall, we are reaching even larger numbers. So on our dashboard, which Giuseppe just mentioned, we know that we have 36,000 in the pipeline, those who expressed interest, out of the 55,000 people we approached to ask whether they had time, they were willing to be involved. And overall, we have already about 4,000 people which have been going through our studies, and we have completed our experiment on that in order to pilot what Giuseppe mentioned before, the blossoming of AI models which have been generating during the Gatekeeper project. And last but not least, we went through a severe self-assessment of, in terms of health economics, because whatever we do, when we introduce a technology, has to imply a transformation of the healthcare services in order to make things sustainable, cost-effective. Because if we just introduce technology without reorganize the way we do care services in Europe, then this will not be sustainable. In order to be sustainable, every time we introduce a technology, we have to be sure that we make the system work in a different manner, in a sustainable manner, and not just for the economical side, also for the environmental impact perspective. But let me close saying that this is not just showcasing. That's not our goal. We just wanted to demonstrate that things can be done in Europe. We didn't want to be the first of the class. We really believe in collaboration. We really believe that this transformation is possible if and only if we do that together with other players which have not been involved in Gatekeeper, with manufacturers, with policymakers, with citizens. Because that's a challenge that we can win only if we play it together. Thank you.
Thank you very much, Leandro. Thank you very much, Giuseppe. Thank you very much, Sergio. I think that now we have the main vision of the project. And it seems that it's going to produce a real impact in our society. And now, during this day, we are going to enter in depth in every one of the concepts that the speaker has been presented in this session. And also we will have this showcase to show the main results of the project on that. So thank you very much, and I wish you all the best day today. Thank you very much.